right? Completely
isn't
flat.
one.
You're right.
Yeah, no arch, right? So what we would say is, well, if you unweight that same foot, does her arch come back, or does it stay completely as flat as it was in weight bearing? So let's look.
So no arch.
Okay, so now let's see your unweighted. Show them your foot like that.
There's some arch.
Apparently
Is there arch? Does it come back?
Yeah.
Okay, so she's a good candidate for an orthotic because she has a supple, flat foot. It changes when she's in and out of weight bearing, as opposed to somebody who's long-standing been like this, who's going to have a rigid, ossified, flat foot. You can't just throw them into an orthotic, or they're going to have a lot of pain. Right? So that's what 2 is. Okay, number 3. So now we have the patient sit right there on the edge of the mat. So this is a test just like, what's a good example? Biceps flexibility test, something like that. Okay, so the person straightens their leg completely, one leg, and they try to dorsiflex.
So hungry.
If they can dorsiflex in this extended position, then it's not tight. Nothing's tight, right, that we're testing. But if she dorsiflexes in this position and is limited, then I would have her flex her knee, repeat the test, now dorsiflex, and she gets all her dorsiflexion back, gastroc tightness, right? Mm-hmm. But if she still couldn't dorsiflex, what could it be? A whole bunch of things. Capsular, ligamentous, osseous, soleus. Okay, moving on. All right, so now, this is just, we're going to talk through it, and then we're going to practice at the end. So what we're going to do is we're going to use this method of finding subtalar neutral. So it's I call it the qualitative method for finding it. And I stole the pictures from